coughing or changes in any intrathoracic pressure, indeed you could have bleeding into an airway, but you could also trade gas. Most people have a trocar in and also cover the needle when they're doing the biopsies. It's pretty standard. And with some other procedures like insufflation of the abdomen, even though it's CO2, they make sure and I don't know if people still do this, but when they put the needle in, they kind of lift it up and do this hanging drop test to see if you're in the right place. But in any event, before you hook it up to an insufflation pump. But here, this is one mechanism of which the gas would come from the outside. Probably the more likely mechanism in all the data I've reviewed is this. The needle causes a small fistulous tract between the pulmonary vein and the small bronchiole. And there is some pressure gradients, and you can get things that go both ways. So that gas would indeed come from the airway. So one of the recommendations is was possibly to put people, one of the things is you want to make sure you usually go for distal lesions, leave the proximal stuff to endobronchial biopsy with like the bronchoscopy, an ultrasound, EBUS. And then ground glass appearance, and most of the interventional radiologists know which ones are going to give you trouble or are not worth going after. That one wasn't specifically a difficult looking lesion, but things happen. Sometimes they cough, they move, etc. So this one, so if you fill the airway with oxygen, at least with the oxygen embolism, theoretically better than air. But this is the mechanism. Good question.
And the other thing is too, usually it's the pulmonary artery that runs alongside the bronchus rather than the pulmonary vein. So
Okay.
Because usually it's the air getting into the pulmonary vein is what's going to cause
Right.
is what's going to cause an AGE because it's going to.
And the artery is what's going to bleed more, right?
Yeah, the artery will bleed more, although it's not super high pressures.
Right, and that one is actually heading right. So this one here, regarding PFO, and I'll show you in a second.
A rare complication, fortunately.
Yeah, fortunately it's a rare, and there's a bunch of literature on this, and it is fairly rare. And one thing that people do is kind of, fortunately it is very rare. But we'll talk about PFO in a second, but this is from the New England Journal. And your specialty, unless you're psychiatry or dermatology,